Hi, I'm Dr. Arun Reedy, a consultant orthopedic surgeon at Continental Hospital, Hyderabad. Since last 3 decades, the knee replacements have been done in a mechanical alignment concept, and it has been evidenced that 20% of patients are unhappy for whatever reasons. And one major contributing factor is having this 1990s straight line concept being applied to all patients. But the patient's knees are broadly classified into 9 types, and bringing all the knees into one single type is one of the major reasons for them being unhappy. With the robotic technology, we can now personalize these knee replacements and make the patient's knee joints feel much more normal and get their forgotten joint scores much better. Since the time I started doing robotic knee replacements, the early post-operative outcomes have been much better. The patients are reporting much lesser pain. There is reduced blood loss. There is faster recovery, and has been evidence that they walk much longer than regular knee replacements. And their mean range of motion, that is the flexion of the knee, is also much higher in robotic knee replacement patients.